Okay, so chapter 11 is a fairly longer chapter, but it's also a fairly important chapter. And in it, we're going to be talking about the rationale, regulations, the recommendations, and training that govern the infection control in the dental office. We'll describe how pathogens travel from person to person in the dental office. We'll list the three primary routes of microbial transmission and the associated dental procedures that affect the dental assistant. We'll list the various disinfectants and their applications used in dentistry. We'll identify and show the proper usage of procedure mouth rinses, high volume evacuations, dental dams, and disposable items. And we'll also identify and demonstrate the correct protocol for disinfecting, cleaning, and sterilizing prior to seating the patient at the end of the dental treatment, in the dental radiography area, and in the dental laboratory. And chapter 11 starts on page 204 of your dental assisting textbook. So some of the rationales of infection control have to deal with observing universal precautions. And this means that in order to protect yourself and the health of your patients, every patient you encounter should be treated as if he or she is infectious. Practice standard precautions means that prior to, during, and after each procedure, it is important to practice techniques that will prevent the spread of infection, such as use of personal protective equipment and body substance isolation techniques. Maintaining the chain of asepsis is practicing aseptic techniques that will prevent cross-contamination from one patient to the next and from one healthcare worker to the next. Many organizations make protecting you and the patients a priority. The ADA makes recommendations through various media, such as journals, the internet, newsletters, etc. The CDC describes body substance isolation and personal protective equipment. The OSHA defines potentially infectious materials and bloodborne pathogen standards. And OSHA is a regulating body to ensure that healthcare facilities are protecting their employees from exposure to infectious diseases or materials. The FDA regulates manufacturing and labeling of medications and medical devices. The EPA regulates the safety and effectiveness of disinfecting and sterilization solutions or sterilizing solutions. OSAP is the Organization for Safety and Asepsis Procedures, which is a national organization of healthcare workers from all health industries and meets to cover topics of infection control and hazard communication. OSHA has to do with the 1992 bloodborne pathogen standard. So with that, it goes over some exposure risk determinations. And there are three categories that have to deal with determining exposure risk. Category 1 includes all tasks that involve exposure to blood, bodily fluids such as saliva and tissues. Category 2 includes all tasks that involve no exposure to blood, body fluids such as saliva or body tissues, but occasionally may involve unplanned tasks from Category 1. These are things like receptionists going back into the treatment room to discuss treatment, coordinating assistants, and so on. And then Category 3 includes all tasks that involve no exposure to blood, bodily fluids, or body tissues. This group includes accountants, insurance assistants, and people that work in the front office. The other thing that OSHA has to deal with is, or that they require, is that each office prepares a written exposure control plan that is updated regularly. Employers must also train initially and annually, and they must provide PPE, which is personal protective equipment. And they must establish a standard operating procedure known as SOP, and they should require that, that all employees have a hepatitis B vaccination. The Needle Stick Safety and Prevention Act was passed in 2001, and it addresses the use of newer, safer medical devices, such as needle recapping devices that safely allow on the dentist or the dental assistant to recap anesthetic needle safely. And it also requires that employers maintain a sharps injury log that should be updated annually at the very least. So where anytime somebody is stuck by a needle, it should always be logged and recorded. All states are regulated by OSHA standards. 24 states are regulated also through a state agency and are often more demanding than the federal standards. The rest of the states are administered through regional branches of the Federal Occupational Safety and Health Administration. And dental offices will be investigated for compliance if there has been a complaint filed, or if an office has 11 or more employees, or if they are invited by the office. Under what category of occupational exposure risks to bloodborne pathogens does the DA fall? Well, because that they are involved with exposure to blood, bodily fluids, or saliva, as well as body tissues, the DA would fall in category 1. So now we're dealing with cross-contamination pathways, and that includes from dental assistant to the patient, from patient to the dental assistant, and can even go on to infect the families and friends of either party. An illustration of the chain of infection can be found on figure 11-1 on page 208, where it starts with the infectious agent. The agent is an entity capable of causing disease. The agent can be biological, so from a living organism, chemical, which is substances that interact with the body, or physical, which is environmental factors that affect the body. The reservoir is a place where the agent can survive. It promotes the growth of the agent under proper conditions. Some individuals may be carriers of an infectious agent, but not become ill with infection. These individuals are still able to transmit infection to others. The portal of exit has to deal with body secretions that somebody makes. The mode of transmission bridges the gap between the portal of exit of the infectious agent and the portal of entry to the new host. Contact transmission occurs through physical transfer of an agent to an infected person, and contact can be indirect, as in through exposure to contaminated secretions, or direct, as in physical contact with an infection person, such as with sexually transmitted diseases. Airborne transmission occurs through contact with droplets of dust particles contaminated with an infectious agent. Vehicle transmission occurs through contact with an inanimate object that carries an infectious agent, such as contaminated drinking water. And vector-borne transmission occurs through contact with an infectious organism, such as with a mosquito. The portal of entry is a route from which the infectious agent enters the host. It can occur through breaks in the skin, inhalation of droplets into the respiratory tract, through contaminated vaginal secretions or semen, ingestion of contaminated food or water, through the bloodstream, and from mother to fetus via the placenta. The host is an organism affected by an agent. The host is affected due to weakness in its system. This can be caused by age, other disease processes, stress, lack of vaccination, and lifestyle risk practices. Can also be through occupational exposure risks, poor nutrition, and genetics. The chain of infection can be broken between any of the links. You can eliminate the spread of the agent to this reservoir through proper cleaning, disinfecting, and sterilization of equipment and work areas. The spread of infection can be eliminated between the reservoir and the portal of entry through proper hygiene, use of clean dressings, and equipment. The key to stopping the infection between the portal of exit and the mode of transmission is to block the exit of the infectious agent. This can be done by having clean dressing, using gloves and masks, and encouraging the practice of covering the mouth and nose when sneezing or coughing. Stopping the infectious process between the mode of transmission and portal of entry is to block the entrance of the agent. This can be accomplished through hand hygiene and the use of barrier protection such as gloves, masks, and gowns. Breaking the chain of infection between the portal of entry and the new host requires blocking the agent from invading the host. This can be done by maintaining the integrity of the skin. If the skins are punctured or procedures required are invasive, sterile techniques must be used. Breaking the chain of infection between host and agent means stopping the infection before it begins. That is the result of maintaining one's health through good nutritional practices, exercises, and maintaining updated immunizations. Here's another dental check. Hand washing and wearing PPE break the chain of infection between what parts of the chain? This would be the mode of transmission and portal of entry to the host. So routes of transmission in the office can be direct, indirect, or through inhalation. With direct transmission, this deals with direct contact with any lesions or microorganisms. It can be direct contact with blood or saliva, or if somebody has an open lesion. Indirect would be through cross-contamination. This can be through countertops, equipment, pens, charts, cosmetics, hair, eyewear, and phone receivers and computer keyboards. Inhalation would come from microorganisms that are inhaled or droplets, hand pieces, or droplets that are dispersed through the ultrasonic cleaner. So for that reason, whenever you're using the ultrasonic cleaner, it should never be running without the top on it. The dental assistant must maintain his or her health and should make sure all immunizations are current. This will keep the immune system working to fight infection. At each appointment, the dental assistant should discuss the patient's medical history to be sure the information on the patient is up to date and accurate. This will allow any current problems or risks to be identified, and procedures can be put in place to prevent any further spread of infectious agents. Hand washing is the most important method to maintaining infection control and preventing the spread of disease. Hands should be washed at the beginning of the day, before and after every patient care, and when donning and removing gloves, after breaks, and at the end of the day. And because us as dental assistants and basically anybody else that works in healthcare, and because we're washing our hands or using alcohol-based hand rubs regularly, because we're removing and donning gloves several times of a day, you can imagine that our hands will get cracked and dried very easily. And these dry and cracked hands will actually promote more routes of infection. It'll promote portals of entry for infections to get into our hands. And for this reason, it's recommended to use a lotion regularly, several times a day, to keep the moisture of your hands there, so that it'll prevent drying and cracking. Eyewear protects mucous membranes from splatter and blood and saliva, can protect your eyes from hepatitis, herpes simplex, and pink eye, can protect your eyes against metal and enamel that can go flying and may cause eye injury. Overglasses are designed to be worn over eyeglasses. Side shields may be placed on personal eyewear. It's difficult to see in the slide. Goggles with side shields are actually recommended type of eyewear. Gloves And with gloves, it's common to see a latex allergy. So you want to be sure that either you don't have a latex allergy or especially the patient. Petroleum-based lotions could break down gloves. So if you're using some type of lotion or moisturizer, which you should, just make sure it doesn't have petroleum inside of the lotion because it'll actually break down the integrity of the gloves. And gloves should be changed after each patient. Over gloves include utility gloves or polynitrile autoclavable gloves, which should be used during disinfecting or sterilizing sharp instruments. Masks include face shields to be worn in addition to masks, and goggles should rest on top of the side shields. Protective clothing should only be worn in the dental offices, not to lunch or at home. They must close tightly at the neck and around the cuff area. They should be used during high-risk procedures and must be knee length. They must be laundered in the office or sent to a laundry service, so they should never be taken home to be laundered at home. Barriers are things that cover any surface that can be contaminated during treatment, and they cover areas difficult to disinfect between treatments. The CDC recommendations for environmental infection control deal with clinical contact surface. These are surfaces that we touch in the operatories, instruments that are transferred, and also splash, splatter, and droplets that are that can land on surfaces that we touch. Housekeeping surfaces include floors, walls, sinks, and windows. Those should also be cleaned regularly and are part of the CDC recommendations for environmental infection control. There are 4 different levels of disinfection. Cleaning is the physical removal of matter. So if somebody spills something or blood gets dropped or vomit gets spilled on the floor, cleaning is merely the physical removal of that matter. Sanitization decontaminates the area, but it's definitely not free of microbes. So if you were to use a low-level sanitizer or disinfecting spray, that would be, or a sanitizing spray, excuse me, that would constitute for sanitization. Disinfection is the next level of disinfection. And with that, we would use a higher level disinfecting spray, such as Cavicide. This will destruct most of the organisms, but not all of them. And things that we can sterilize is the highest level of disinfection. This is when the destructions of all microorganisms occur. And the only time that sterilization can be achieved is through the use of some type of autoclave. Various disinfectants are used in the dental office. These include chlorine dioxide, glutaraldehyde, sodium hypochlorite, iodophor, phenolics, and alcohol. Some provide high-level disinfection, and some provide low or moderate level disinfection. You want to look at table 11-2 in your textbook so that we know which one is the highest level, which one is the lowest level, and then which one is the moderate level. The disinfection technique most common is the spray wipe spray method. With this technique, you will first spray all surfaces that are contaminated with a high level disinfectant. You will wipe to eliminate surface debris using the same or using a cloth or disposable cloth that is soaked with the same chemical. And then you'll spray it again and let it sit for approximately 10 minutes. And then finally wipe the surface again. Ultrasonic cleaning is a holding bath where debris or hardened debris is loosened from the instrument prior to sterilizing by submerging the instruments. And you will submerge the instrument in 3 to 10 minute cleaning cycles where sound waves are used, or ultrasonic sound waves rather, to actually break down the debris. Cavitation process is when the bubbles implode. A dishwasher disinfector device provides a high-level disinfection. It has a thermal disinfector where it washes, cleans, disinfects, and dries. I'll be honest, I've never actually seen a dishwasher disinfector device in any of the offices I've ever worked at. And this is because disinfecting or sterilizing instrument is usually achieved through first an ultrasonic cleaning bath, scrubbing the instruments more thoroughly if need be, and then placing into a steam autoclave, which would effectively kill all microorganisms. All forms of microorganisms are destroyed in the process of sterilization. The dental assistant most often is the person who ensures that all items used in intraoral procedures are sterile. Many types of machines and tools are used to sterilize. So this can be a liquid chemical disinfectant, ethylene oxide. There is a dry heat autoclave, a chemical vapor autoclave, a steam pressure autoclave. Sterilization includes, with sterilization, the equipment maintenance is necessary for proper function and to ensure the correct solution is used in appropriate machines. Hand pieces should also be lubricated, cleaned, and sterilized, and all instruments should be packaged and loaded into a sterilizer. After they have been completely dried after the sterilizer, they should go into an instrument storage where the instrument can be stored safely in an enclosed container so that it remains sterile until the next use. So talking about sterilization monitoring, biological monitors are often the most accurate way to assess the sterilization has occurred. Process indicators are normally heat-sensitive tapes or inks printed on packaging materials. Dosage indicators are dyes placed in the sterilization packaging that change color when exposed to dry heat, chemical vapor, or steam. And these monitor for liquid disinfectants or sterilizers. Certain monitors for liquid disinfectants and sterilizers don't exist. However, by using several strips to test concentration and following EPA directions, this will ensure the product is working. The use of a pre-procedure mouth rinse is a recommendation. This reduces the number of microorganisms in the patient's mouth before treatment. So a lot of times this will be like a mouth rinse that has hydrogen peroxide or some type of disinfecting mouthwash prior to treatment. The high volume evacuator will effectively reduce spray coming from the handpiece and air water syringe. And this reduces the risk of inhalation exposures and releasing pathogens into the air. The dental dam provides a barrier to the fluids in the oral cavity during procedures. And equipment that may be disposed of after one use eliminates the possibility of transferring microorganisms by cross-contamination. Here's another dental check. Explain why hygiene is so important. Well, it's because it prevents the spread of infection from the DA to the patient and from the patient to the DA. Clinical asepsis is creating an environment free of pathogens, and it is key. A dental office should always be not only meeting government standards, but striving to keep things as clean as possible. After the chart has been reviewed, or actually before a chart has been reviewed, hands should be thoroughly washed. And after the chart has been reviewed, it can be placed under a plastic envelope barrier or surface barrier. If you're using digital charts, which most offices are, keyboards and mice should be covered using some type of plastic barrier. New barriers could be placed on dental chairs, hoses, counters, light switches, and controls. The instrument tray should include packaged sterile instruments with the patient's napkin and protective eyewear. PPE should be last, including eyewear, masks, gloves, and over gloves if you're having to touch something, some other type of surface like a phone receiver, a keyboard, or a mouse. After the completion of dental treatment, gloves should be kept on until all potentially infected materials have been removed and disposed of properly. So when the completion is done, you'll want to move the tools back to the treatment tray. Document information on a chart or computer with over gloves on if you're not using some type of barrier on the keyboard or mouse. You'll remove the patient napkin and dismiss the patient, and then come back and remove all the barriers on the operatory with the gloves on. You'll remove the gloves and wash your hands. The final cleaning is when you'll put utility gloves on, and then you'll go back into the operatory and employ the spray wipe technique. And you want to set a routine. So by following a routine procedure that meets all regulatory standards, as well as each individual office, the dental assistant completes this practice routinely, and they make sure that you're not missing any steps. Dental unit water lines are small tubes that connect water line or water to the instruments or from suction devices. These will accumulate a biofilm after amount of time, which is a thin layer of bacteria that lines the tubes. So for this reason, we want to flush each water line at the end of each day and between patients. And there's special water line flushing solutions that can be used in devices that will help to flush these water lines. Anti-retraction devices should also be installed to prevent backflow of suction into the patient's mouth, or to prevent the backflow of water from getting into the handpieces or air water syringes. Oftentimes, the dental radiography and equipment room are missed. This is not okay. So before and after each patient, you should prepare these rooms similar to any treatment room. And then you want to disinfect the room once it's completed, or once a patient is done, disinfect the room again. With the dental laboratory, you want to disinfect these the same manner as any other room. Even though patients aren't necessarily involved in direct contact with dental laboratories, we want to make sure that we're not cross-contaminating appliances or equipment. That's because a lot of the times we're dealing with impressions that were in a patient's mouth, and blood and saliva may be contaminated on these. They will be contaminated on the impressions, and they should be decontaminated before dealing with any equipment. So you want to clean and disinfect the area after working, and you want to clean and disinfect the appliances that are created. That's because a lot of the times there are, in order to create an appliance, we have to pour stone into a model that was in a patient's mouth. And if you can imagine, cross-contamination can occur this way. So the next dental check is, what is the disinfection technique used to prepare the treatment room? This is the spray wipe technique. Okay, so that's everything I have for chapter 11. Please let me know if you have any questions. Thanks for listening.